If your child has autism, there's a question you may have never been asked at a doctor's visit, but you should be. Has anyone tested their genes? Because two of the most talked about genes in autism today, PTEN and MTHFR, are not the same thing. They look similar on a search engine. They are completely different in real life. And knowing the difference could change what kind of care your child actually needs. Let's start with the basics. Autism is not one condition, it's a spectrum. And researchers now believe that about 90% of autism risk comes from genetics. Around 800 different genes have been linked to it. PTEN and MTHFR are two of them, but they affect the brain in very different ways. So let's look at each one. First, PTEN. PTEN stands for phosphatase and tensin homolog. Don't worry about the name. Here's what matters. PTEN is a tumor suppressor gene. Its normal job is to slow down cell growth. When PTEN doesn't work properly, cells grow too much. In the brain, that means more nerve fibers, more connections, and often a larger head. About 20 to 25% of children with a PTEN mutation have autism, and about 2% of all children with autism carry a PTEN mutation. But here's the key number. If your child has autism plus an unusually large head, called macrocephaly, the chance of a PTEN mutation jumps to about 20%. Children with PTEN-related autism often share a specific profile. They tend to have a noticeably larger head, sometimes 2 to 8 standard deviations above average. They often show motor coordination challenges and slower reaction times. They may have muted sensory responses, meaning they might not notice wetness, temperature, or touch the way other children do. They can struggle more with short-term reasoning and decision-making. And importantly, many parents describe them as generally happier, more socially motivated, and more adaptable to change than children with other forms of autism. But PTEN comes with something parents must know about. Because PTEN normally suppresses tumors, mutations in this gene also increase the lifetime risk of certain cancers, especially of the breast, thyroid, and uterus. This is called PTEN hamartoma tumor syndrome. That's why a PTEN diagnosis isn't just an autism diagnosis. It's a full medical roadmap that includes cancer screening, seizure monitoring, and sometimes targeted treatments like mTOR inhibitors that are being studied right now. Now let's talk about MTHFR. MTHFR stands for methylene tetrahydrofolate reductase. Again, don't worry about the name. What it does is much simpler. MTHFR is an enzyme that processes folate, the B vitamin found in leafy greens and added to most cereals and breads. Folate is essential for building DNA, for brain development, and for clearing out a substance called homocysteine. There are two common variants of MTHFR, called C677T and A1298C. They are not mutations that cause autism on their own. They are small genetic changes that reduce how well the enzyme works. If your child has one copy of the C677T variant, enzyme activity drops by about 35%. If they have two copies, it drops by up to 70%. The A1298C variant has a milder effect. A large meta-analysis of over 10,000 people found that the C677T variant is associated with a roughly 60 to 80% increase in autism risk. That sounds dramatic, but here is the most important finding in that entire study. In countries where folate is added to grain products, like the United States, that increased risk largely disappears. In other words, adequate folate in the diet appears to buffer the genetic risk.
Children with autism who also carry MTHFR variants do not have a distinct physical profile. There is no large head. There is no cancer risk. What they may have is a quieter biochemical issue: lower folate levels in the brain, higher homocysteine, and sometimes increased oxidative stress. Some studies suggest these children may respond to specific forms of folate, like methylfolate or folinic acid, but this should only ever be done under a doctor's supervision. So let's put them side by side. PTEN is a structural story. It affects how the brain is built, often produces a larger head, comes with cancer risk, and shows up as a specific behavioral and motor profile. It is a syndrome with its own medical surveillance plan. MTHFR is a biochemical story. It affects how the body uses folate, has no physical markers, carries no cancer risk, and may be partly addressed through nutrition and targeted supplementation under medical guidance. PTEN testing is typically recommended for any child with autism plus extreme macrocephaly or signs of overgrowth. MTHFR testing is more controversial. Many genetics organizations actually recommend against routine MTHFR testing because the variants are extremely common in the general population, and a positive result alone does not necessarily mean treatment is needed. The decision to test and what to do with the results should always involve a genetic counselor or pediatric specialist. Here's what I want you to walk away with. If your child has autism, especially if they have a large head, developmental regression, seizures, or a family history of certain cancers, ask your pediatrician about genetic testing, specifically chromosomal microarray and next-generation sequencing. These tests now can identify a clear genetic cause in nearly half of all autism cases. That doesn't change who your child is, but it can change what care they receive, what they are monitored for, and what therapies may actually help. Autism is not one thing, and the more specific the diagnosis, the more specific the support. If this helped, please subscribe, because in the next video we're going to break down what a chromosomal microarray actually tests for and what to ask your doctor at your next appointment. Take care and give your kid an extra hug today. They deserve it.